Hi everyone, in today's video, I'm going to walk you through using Glass, an AI-powered clinical decision support system designed to help you improve your workflow in patient care. Step 1. Sign up and log in. Head over to Glass Health's website and sign up for an account. Once you're signed in, you'll be ready to use Glass's features. Step 2. Enter patient information. You'll be able to enter a patient summary into the Glass interface. This summary can include things like the patient's medical history, current symptoms, and any test results you have on hand. Step 3. Generate differential diagnoses. Glass will analyze the patient's summary you entered and suggest potential diagnoses for you to consider. This can be helpful for complex cases where you might be unsure of the underlying cause of the patient's symptoms. Step 4. Draft clinical plans. Based on the patient's summary and potential diagnosis, Glass can then draft a preliminary assessment and plan. This plan will include evidence-based suggestions for diagnostic tests and treatment options. Step 5. Review and finalize. It's important to remember that Glass is a tool to assist you, not replace your expertise. Carefully review the suggestions provided by Glass and use your judgment to finalize the diagnosis and treatment plan for your patient. By leveraging AI, Glass can help you save time, improve diagnostic accuracy, and ensure you're considering evidence-based treatment options for your patients. Be sure to visit our site, where we have collected thousands of services that use artificial intelligence, including alternatives to Glass. This way you can find the perfect AI tool to fit your specific needs.